Hi, welcome back to Talk of the Town. With eye care changing and becoming more convenient, Dr. Michael Campbell of Optical Solutions shares the vast improvements he has seen over the last 30 years in his profession. Mike, welcome to the show.
Oh, thanks for inviting me.
Nice to see you, absolutely.
Thank you.
So, you've been in this profession for quite a long time, and obviously you've seen the changes over the last 30 years. You know, what's happened?
Yeah, I think that the scope of practice in the last 30 years in South Carolina has allowed optometrists to treat eye diseases like glaucoma and conjunctivitis with topical and oral medications, things that we weren't able to do, you know, in the 30 years previous to that. So again, it's allowed us not only to diagnose but to treat problems that we see on an everyday basis.
Which makes for a lot of people a lot more convenient, obviously.
Yes, convenience is a big factor.
So what's the difference between an optometrist, ophthalmologist, and then an optician?
Right. An optometrist gets his undergraduate degree at a four-year program and then moves on to one of 22 optometry schools in the country for a four-year doctorate's degree, and then has to pass 3 parts of a national board as well as a state board in which he wants to practice in. Ophthalmologist gets his undergraduate degree, then goes to 4 years of medical school, and then concludes with a residency program in eye surgery. The optician gets his prescriptions from a optometrist or ophthalmologist, and is the person then that goes ahead and surface or grinds the glasses, makes the glasses for the people.
Okay, gotcha. Yeah. So does the internet always have the eye care of consumers' best interest, do you think?
Again, the internet is a huge platform for information, and again, you've got contact lens prescriptions out there that eye doctors, whether optometrists, ophthalmologists, work very hard to perfect and make sure that they're not only seeing well but fitting well. And sometimes these prescriptions, again, are something that is the patient's right to take and get their prescription anywhere they want. But again, the internet has gotten to be a way that I think makes people believe they're getting a huge discount or savings, when in reality the fit and the vision are the most important things. I mean, contact lenses are a medical device. They're not a commodity. They're something that can get people in a lot of trouble if they don't wear them properly, and that's where I see the internet kind of getting in the way of proper eye care.
It's like they're self-medicating even in the eye industry.
Exactly, yes.
So how up-to-date is the eye care world in Beaufort County?
Beaufort County has some of the most experienced expertise in the eye care industry in South Carolina. The fact that we see patients that we take care of in our offices on a daily basis with glaucoma and macular degeneration, conjunctivitis, is something that optometrists perform. And then when we're in a situation where we have to go into more specialty, the ophthalmologists in the area with their glaucoma, retina, or cataract specialties are something that we refer to, and they take care of the situation and then refer them back to us.
Right. And so do big corporate giants threaten the smaller local optometrists and ophthalmologists?
Yeah, I think your big corporate eye care professionals like Lens Crafters, Pearl, America's Best, and Walmart, they all have their place. And again, the people that seem to visit them are more money conscious, and sometimes they, and that's fine. But again, in private practice, the technology and time and expertise that we offer patients on a daily basis. For example, if someone is coming in our office and looking for a LASIK surgery, we've got orb scans, wave scans, topographers, things that you're not normally going to see in a commercial setting, and so we take that specialty to a different level.
That patient care is at the top level.
Exactly, yes.
And so quickly, what do you think we might see as far as changes in the next 20 years?
Yeah, I think you're gonna see a big changes as far as new pharmaceuticals coming out. Currently, your dry eye patients have one medication, one choice as far as like Restasis for their treatment. You're going to have 5 or 10 choices in the next 20 years to take care of that particular disease like dry eyes. But other things like glaucoma, macular degeneration, they're eye diseases that are going to have a lot of good, effective treatment, and that's something I'm looking forward to over the next 20 years.
Mike, thank you so much for joining us and for great information.
Thank you.
And we'll be right back with Talk of the Town.